You know, chronic fatigue syndrome is a mysterious condition that has baffled doctors for many years. Now, last week we spoke with Laura Jane, a chronic pain patient who has over 1,100 subscribers on YouTube. Her channel is called Laura Jane, Laughter, Lifestyle, and Creative Musings. Now, Laura talked about living with CFS, how she's overcome struggles during her life while battling this condition, and chronic fatigue syndrome as an invisible illness. I encourage all of you to click on the link below to subscribe to her channel on YouTube for awesome, insightful, and funny videos. Today we welcome Laura back to the show. Laura, how are you today?
Hi, I'm good, thank you.
Now, Laura, was there one treatment or several that led to your improvement?
I think it's quite hard for me to pinpoint something. I'm not really sure. I tried a few things. I went to doctors and specialists, and then one specialist referred me to a breathing clinic, and she said I had hyperventilation disorder, which means I was breathing through my mouth and up into my chest, so I wasn't getting enough oxygen to the rest of my body, which can make people tired, and was also explaining kind of a lot of the weird poor circulation I was having in my hands and feet and joints and things like that. Other than that, I was also on beta blockers because about a year after being diagnosed with CFS, they found out I had a heart condition called premature arterial contractions, which is usually just, something they don't bother treating. But I was just noticing my palpitations a lot, so they put me on beta blockers to help them. And my specialist recommended that I come off of those because those can make people quite drowsy.
Interesting. What tips or advice do you currently have for those struggling with CFS?
I don't know. I think just try and stay positive because it's so lonely and depressing and scary to see your life being taken over by just feeling tired and you don't know what's going on. But I also recommend getting tested for a lot of things. Make sure you're not just labelled with it, or don't self-diagnose yourself, because chronic fatigue is also a symptom of other major illnesses. It can be a side effect of nearly anything. So make sure your doctor rules out all these other options like cancer and diabetes. But other than that, I guess just try and stay as healthy as possible, eat good food, try and go out when you can, if you can, go and socialise when you can, if you can, because that's all going to help, contribute to your positive mind state.
Is there anything you would have done differently on your CFS journey?
This is a hard question. I don't know. I think sometimes I feel like I didn't do a lot, but then when I think back, I was in the doctor's office like monthly getting blood tests done, and either that or I was in there getting anti-nausea things because I always seem to catch stomach bugs for some reason. I guess it's because my immune system was shot, but I don't know. I feel like maybe I wouldn't have pushed myself so hard when I had glandular fever. I feel like I should have just waited the glandular fever out, and maybe that would have made a bit of a difference, and maybe I wouldn't have ended up with chronic fatigue. Maybe I should have got myself on a better sleep schedule, but that's really hard to do because sometimes you can sleep and sometimes you can't sleep. So I don't know if there's a definite answer to something I would have liked to do differently, but maybe just not getting it. That would have been a great idea. Let's not get sick in the first place, Laura. That would have been so smart.
Now, do you have a special message to anyone who might be watching this video right now?
Yeah, thank you so much for being such an awesome community. I mean, I know that we're not all in the greatest situation, but I think it's a really nice, supportive community, and I think without all of this online support and having forums and things like Pain Doctor around, that, we'd all be in such a worse off place because we wouldn't have as much information and as much help and support, and we would feel a lot more alone. So I think, stay strong and just try your best to wait it out, and good luck.
Laura, thanks again for being on the show these past few weeks. You truly are an inspiration to so many out there who are struggling with chronic fatigue syndrome. I hope you join us again in the future as we work to try and find ways to eliminate chronic fatigue syndrome from everyday life.
Thank you.
We hope you enjoyed our chat today and over the past few weeks with Laura Jane. Please be sure to subscribe to her channel by clicking on the link below, where you can find tips on how to deal with CFS, do-it-yourself videos, and healthy recipes to help you deal with your condition. And that's another dose of pain news brought to you by PainDoctor.com. For more information about stories about chronic pain, subscribe to our YouTube channel, follow us on Twitter, and like us on Facebook. Thanks, and have a pain-free tomorrow.